It's very strong. Okay.
Okay, can I see a show of hands of who knows about the ComSet building, which is also known as registration? Okay. And who knows about the small cottages like right next to it? Okay. Who knew that these buildings were once part of Pilgrim State Psychiatric Center? Okay. If you want to know any more, on lioddities.com, it lists all of Pilgrim State's original buildings with, whether they're knocked down or whether anyone owns them now. As mentioned in my last speech, I want to be a psychologist, so that's why I did my speech on the psychiatric center, because it's very interesting to me. And abandoned psychiatric centers are especially interesting to me. And I felt like everyone else would be interested in this because the psychiatric center is like a block or two away from school. So everyone knows about it. Some of you may drive by it every day like I do when I go home from school, things like that. So obviously my speech is on the history of Pilgrim State Psychiatric Center. I will be covering when and why it was built. I will be describing some of the buildings and what went on inside of them. I'll be talking about some of the treatments, and I will also talk about the decline of the biggest psychiatric center in the world. Pilgrim State was opened in 1931, and it was named after Charles Pilgrim, who was the Commissioner of Mental Health at the time. Pilgrim State was built because of the local psychiatric centers, Kings Park and Central Islip, due to overcrowding. The overcrowding was due to the World War II veterans. They were thought of to be going crazy when they were really just shell-shocked, which we now know is known as post-traumatic stress disorder. Pilgrim State was the biggest psychiatric center in the world. This is a newspaper cutout. I would have put more on there, but it's kind of crushed. And according to the Office of Mental Health, Pilgrim State had its own farms, fire departments, police departments, courts, church, and they had their own cemetery as well. Now, if you're like me and you take the Pilgrim State, the Saginaw Coast Parkway home, you might wonder which building that is that you drive by every single day. That brings me to my next topic, which is the buildings, and that building is Building 23, which is right here. Building 23 was the medical and surgical center. Patients went there to get evaluated and diagnosed with what they had. They also went there to get lobotomies, which I'll be talking about a little later. Building 7 was the morgue and autopsy room, which is right here. That's the autopsy table, and those are where the dead bodies went. And according to opacity.us, random body parts and organs were stored in the room right across from the autopsy room for, like scientific studies and stuff like that. Doctors and nurses also lived on campus with their families. They did this so in case of emergencies, they could be easily accessed, and that's where the cottages come in. Those were nurses' homes at one point. Pilgrim State also had its own nursing school, building for the physically sick, and they also had their own barn. And Pilgrim was so big that it had to have its own water plant and power plant of its own. In 1944, the U.S. Army opened a hospital adjacent to Pilgrim State. They held war veterans, and it was also a prisoner of war camp. And unfortunately, after 2 years, they didn't want to keep it up anymore. So they gave it over to Pilgrim State along with all of their patients, which caused more overcrowding in the psychiatric center. During the 40s and 50s, there were no medications or drugs for the mentally ill. So they used old-fashioned treatments that today we may look at as kind of cruel and dehumanizing in some ways. But back then they were looked at as very miraculous because they made people seem more sane and more happy. Pilgrim State was best known for their frontal lobe lobotomies, which is a picture of it right here. It's nothing gruesome. Though we know the risks of this today, which is speech and motor problems, back then the patients seemed happier, more relaxed, more sane, and in some way they were somewhat in a zombie-like trance. Although lobotomies were only supposed to be used on schizophrenics, they were also used on mental retardation and people with manic depression because they were misdiagnosed. You know, we didn't have all the different diagnoses that we do now, so they were kind of all put into one category. Insulin shock therapy and electroshock therapy was also very popular at the time. It made patients go into a coma for a couple days, and then once they woke up, like I said, they were it was kind of used as like an anesthetic. The patients would seem very zombie-like, but they would also seem happier and more sane. Electroshock therapy is still used today, by the way, which I find ridiculous. Some of you might be wondering, how did Pilgrim State get the way it is today? Why was it abandoned if they were doing so well? Once pharmaceutical medications came out, many psych centers, including Pilgrim State, had major declines. The drugs seemed less harmful and less severe than these old methods, and people also wanted their loved ones at home with them, so it was easier to just give them a drug rather than throwing them into an institution and never seeing them, basically. In 1996, Kings Park and Central Islip closed down, and all their patients moved to Pilgrim State. The move was extremely disorganized, and it was very sudden, so a lot of things were left behind. That's why if some of you go in there now, there are so many things there, like patients' paperwork, history records, belongings, medical equipment, things like that. In that same year, many of Pilgrim State's treatment groups shut down because of the drugs. They were more useful and they worked better. Soon after, many of Pilgrim State's buildings shut down due to lack of patients. Everyone was pulling their loved ones out because of these drugs. They worked better. In 2003, 54 Pilgrim State's abandoned buildings were demolished by the state. And this is a picture of the nursing school, and it's really small, but there was like the library full of books, and there was a bunch of nurses there. And then this is it after. I wish it was bigger because it's creepy looking. Today, still a few buildings are up and abandoned, and still a few buildings are up and in use. Now, Pilgrim State has a rehabilitation center and the Long Island Psychiatric Museum, which I didn't know about, and I'm probably going to go there because I'm interested. And Pilgrim State history, to me, is a good example of how different we treat the mentally ill today. Back then, we were so quick to just throw them in an institution and heavily sedate them, not try to understand them. But today, I feel like we're now more in tune to the mentally ill rather than just trying to tune them out. So from now on, when you cut through Pilgrim State's abandoned campus, you'll know a little bit more about this historical landmark. Thank you.